here with Dr. Agnieszka Laskus here in Poland, Warsaw. Thank you for having me out to your office.
Very nice
impressive.
visiting you.
Thank you. Started 20 years ago, right? Use that laser?
Maybe in Poland, not in Europe, okay? Yes.
Excellent. What got you interested in adding lasers as a tool for your practice?
Maybe this is closely connected with my specialization. I'm a periodontologist, and for me it's very useful in my day work practice for the contamination of the pockets, for some changes in oral mucosa also. And also in implantology, we have a lot of complications, peri-implant complications sometimes, and especially also in peri-implantitis. So this is something that is useful and good for me. That's why I'm using Waterlase and also Epic Pro, and so biotic laser also.
So you have, it sounds like a full laser protocol for both periodontitis management and also peri-implantitis.
Yes, and also for some oral mucosa problem, because we have a lot of changes on oral mucosa, so which this laser is also very, very useful. So I think that it's a very good tool in our hands we can use in this kind of patients with this kind of problem.
Now, doctors have been treating periodontitis for years, centuries, right? I believe. Now, obviously, that's changed over the years. You were treating periodontitis before the laser, right? And then you got the laser. What have you seen as far as the differences go, and maybe how do the patients feel about having the laser versus more traditional treatment?
When you have a laser, we have more possibility to do the same procedure, let's say the contamination of pockets around the implant, without using general antibiotic therapy. So it's one of the good arguments for the patient. So we can use something which is good for local decontamination, and it helps to reduce more bacteria. If you use lasers, we have another arguments for the patients, and it really works. There are some tips on the laser, like sapphire one, yes, right. Which is very good for the surface of the implants, yes, because we can damage this, but it helps to decontaminate this area. So this is my, let's say, general argument for the patient.
Right, and so it sounds like, based upon that conversation with the patient, that you may have better patient case acceptance for that. So once you talk to them about the laser, or maybe the non-invasive manner, they're more receptive to having the procedure done?
I mean, there are some arguments which are very important, that we can reduce time for procedure, we can reduce pain, we can reduce bleeding during the procedure, and with laser it's sometimes easier, and the patient understands that the reduction of pain, reduction of bleeding, this is argument.
Understood. Well, thank you so much for having me out today. It's a very impressive office. I know that you are certainly a pioneer in your field and very respected, so thank you so much.
Thank you so much for visiting us, and the first time in Poland, so yes. I am even more happy that with my clinic.
I know if I ever need dental work in Warsaw, who I'm coming to. Thank you.
Thank you.